right? Lid proportion also has to be 1/3, 1/3. Upper lid is supposed to be 1/3, lower lid going to be 2/3, right? In the middle side, you got a filtro column, right? Filtro column, and then you got a vermilion and skin junction where we call a white row. White row, you look at your friend on the side, I know everybody on the mask, it's very obvious. Why? Because a different color tone and the most prominent. When you are talking about reflections, this is the most obvious reflection that you see under light. So that's why disruptions of this line is going to be very obvious. Right? So when you are actually doing something, make sure you don't damage that row. Become very obvious. Not so much on the lower because you got a prominence vermilion on your lower lid. Too prominent both sides. So that will actually sort of obliterate the white row of the lower lid. Upper lid, make sure that you don't damage that, whatever you do. Okay? Reason? To correct it. Very, very difficult. Nampak simple aja. So what? But to correct it, to get it nicely done, matching 100% matching is very difficult. Sometimes you need to reverse few times. Because you are talking about a dynamic structure underneath. Okay, kalau you tutup and do you approximate it nicely, also still you got a chance to actually move when you are actually talking about moving the orbicularis oris muscle. You have to move orbicularis muscle. You cannot stop that because they want to eat. So that's how difficult it is. Right? For your orbits, again, the normal one, you see the normal one, okay? So you got a lateral canter, medial canter, lateral canter. This distance from here to here, here to here, here to here is 1/3 again, right? Roughly lah. Of course, now people are talking about the middle or the lateral is 1.0, 1.018, I think, or 1.18, something like that. And then he's actually 1 and then 1.018 again. It's a bit different on the intercanthal compared to the nasal. When you have you don't have, you call it cyclopia. Tak ada. There's no canthal. There's no canthal. When you got the between the two medial canthal, you got hypothallorism. Alright. Normal is normal lah. So telecanthal when you got bigger than 1/3. Send the telecanthal. Hyperthallorism when you got a bony part of it. You got bony part on nasal is actually wide. So you got a hypothallorism. And you can actually have hypothallorism and telecanthal. Both. Right? I'm not telling about the blocking now, I'm telling about the anatomy. So you got a orbicularis oris muscle, and then usually they insert into your end of the tarsal plate and to the skin, right? It's actually to the skin and then connected with the tarsal plate. You got a molars muscle there, is actually where your eyelid crease, right? And then you got a septum, orbital septum. This is a very sensitive septum because behind that is a very loose areolar tissue, right? You do anything on your eyelid, make sure that you don't go inside there. So you go inside there, small bleed will actually extend all the way up to your retroorbital because this is very loose area. So make sure that you don't actually break that. Okay? Lower lid also like that, right?